Hi, Dr. Momo here. Today's topic is tongue ties. You've all heard about it. Some of you know what it is. Some of you are like, what the heck is it? All right, so we're going to break it down today. Breastfeeding, bottom line, breastfeeding should not feel like you're nursing a tiny piranha. So if your nipples are crying for help or baby is struggling to take a bottle, your baby might have a tongue tie. There's a lot of other things that could be going on, but today we're going to focus on tongue ties. So a tongue tie happens when this little piece of tissue under your tongue, the frenulum is too tight. So when this is too tight, baby can't move their tongue around the way that they need to in order to get a good latch on a bottle or a boob. Okay, so that's going to, for you breastfeeders out there, that's going to result in a really painful latch, most likely, and baby's just not transferring well. So how do we know if baby has a tongue tie? Here's a few possible cues. Okay, is baby struggling to latch or popping off constantly? Do you hear a clicking noise when baby is nursing? Yeah, that's not supposed to happen. So check with your IBCLC. That indicates a bad seal, and a lot of times that is because of that tongue tie. Is your baby nursing all the time? Like all the time, not just cluster feeding for a few days during a growth spurt or some other transitional change. Do they have extreme fussiness, gas, or reflux-like symptoms? Or when your baby goes to stick out their tongue, is it heart-shaped or doesn't extend past their lips? So, normal. It's that. That's not normal. All right, so... And don't forget about clues that you might be getting, like if you're dealing with sore, cracked nipples, constantly clogged ducts, or supply struggles, your baby's latch might be the culprit. So what do? First, don't panic. Get help from your friendly neighborhood IBCLC who can assess your baby's latch and help you adjust things. And good news, most insurance covers up to 6 visits with your IBCLC. So if a tie is suspected, your IBCLC will refer you to a pediatric dentist or an ENT or a midwife or whoever is doing whoever is doing frenotomies in your area. Okay, there's a simple procedure called a frenotomy that might help, but it's not always the first or the only fix when your kiddo has a tongue tie, but your healthcare team will help you decide that. Babies with tongue ties often have tightness or tension in their jaw or in their body from being restricted in the womb. Remember that birth? It wasn't easy for you or that little kiddo. So a lot of times that's where chiropractic care or craniosacral therapy or speech or occupational therapy might be able to loosen things up and get things moving again and prevent you from having that frenotomy, or it might go hand in hand with that procedure. But you want to make sure that you're going to people that specifically work with babies. You're not going to your cousin's chiropractors who just cracks backs all day, okay? That's not it. Reach out to your IBCLC. They will know the right people in your area. Your IBCLC is an amazing resource. Reach out to them early and often. Don't suffer. Don't let your baby suffer. Remember, insurance likely covers 6 visits thanks to the Affordable Care Act. Okay, bottom line, a good latch shouldn't be painful. And if feeding just feels off, trust your gut and get the right support, because feeding your baby should be good for both of you. All right, in the meantime, do good, kiss the baby, love yourself. Toodles!